Hi, everybody. Welcome to our April Talks on Tuesday, Infant and Toddler Sleep Basics 101. We are delighted to have you join us. I am Corey Hill. I work at the Partnership for People with Disabilities at Virginia Commonwealth University, and I'm the Early Intervention Professional Development Specialist. We are glad you're here, and I am delighted to welcome Stephanie Shrewsbury, who is a certified infant and toddler sleep consultant. And I am going to turn it over to Stephanie. Thanks, Stephanie.
Yes. I'm going to go ahead and turn my camera off here and we'll get started. So a little bit about me. I am very happy to be here today and share all things sleep with everyone. My name is Stephanie Shrewsbury, and I have been an early intervention service coordinator for the last 11 years with the Virginia Beach Infant Program and a certified pediatric sleep consultant since around November of 2020. So my husband and I, we welcomed our first baby into the world about 2 years ago, and we are expecting our second in June. So how did I fall into sleep consulting? I knew absolutely nothing about infant and toddler sleep prior to having our son. The only thing I anticipated was never getting any sleep for the foreseeable future because that is what everyone told me to expect. I slowly became obsessed with reading about all things sleep and schedules and just the ever-changing sleep that a baby and toddler will go through. So in May of last year, in 2020, right around when the pandemic was at its highest, I decided to go ahead and sign up for my certification. And like I said in the previous slide, that's where November was when I finally finished and became officially certified. Sorry, I'm having a little lag here. There we go. All right, so let's talk about newborn sleep cycles. As they get older, they normally reach a similar pattern to an adult's sleep cycle by the age of 5. But right now, when they are newborns, they spend about half the time in REM sleep versus the usual 25% that adults do. So newborns dive right into REM and then transition into what we call quiet sleep. So while in REM, newborns will twitch, move a lot, smile, and make noises. When you see some of those photos of your friends' babies and they're like, look, he smiled, most likely they were in REM sleep and doing a little smile during that. So in quiet sleep, their breathing becomes slow and they rarely move at all. It is important to practice what is known as les pauses. This is something that the French invented, and they have practiced les pauses for quite some time, and it is just that. Pausing to make sure that your baby is not transitioning into another cycle or just moving around in their sleep. They tend to listen closely to the sound their babies make, which helps inform them about when they really need attention and when babies are just making noises in their sleep. So many parents accidentally wake their babies up because they think they are awake while they're actually in REM or transitioning into quiet sleep. So that's a big tip that I give parents of newborns is just practicing that pause. Obviously, you'll know when your baby wakes up and is crying and needs to eat, but making sure that you practice that, especially in the nighttime as well, when they make a lot of noises. So when do they mature? It isn't until around 3 or 4 months when you will see their sleep cycles or see a baby sleep pattern begin to mature. So this is when you will see the 4-month sleep regression that you will hear from the families that you work with or that you've experienced yourself. So we will touch on regressions a little further down in the presentation. All right, so we're going to do a poll question. True or false? Keeping a newborn up all day will help them sleep better at night. So keeping a newborn up all day will help them sleep better at night. Go ahead and get your votes in. Yep, so we have lots of votes in so far, and everyone that answered false, that is correct. Making sure that your newborn gets ample sleep during the day is crucial for their nighttime sleep. An overtired baby at nighttime can cause many night wakings and just be extremely difficult for the parent to get them down in general for bedtime. So now we want to talk about fostering and encouraging these healthy newborn sleep foundations, and then starting with a healthy foundation from day one. So we're going to discuss a little bit about the environment, safe sleep, routine, and then also soothing baby as well. Okay, so environment. A temperature typically between 68 and 72 degrees, and then darkness. We want to see, I love to recommend blackout curtains for nap and nighttime. That can really help them with establishing the difference between night and day. White noise to block out sounds, and then also imitate the sounds of the womb in the first few months for the baby. And then, of course, a crib, bassinet, or play yard. So you'll see here the environment is very light and airy. It's a beautiful picture, but we would typically like a dark environment for sleep. And then there are some unsafe sleep things going on here, a couple pillows and the curtains hanging over, and that's what we're actually going to touch base on next, is safe sleep. So we're going to start with a chat question. What do you see in this image that is not safe for sleep? So go ahead and drop your answers in the chat box for me. Yes, a stuffed animal for sure. They should be along the bumpers. Cloth on your head, the pillow. And then there's also a little bracelet around his hand as well. So I know that there's mesh bumpers out there now, but the mesh bumpers are also not approved by the AAP. And he should definitely not be sleeping on a pillow. That's typically recommended to be introduced around age 2, and no stuffed animals as well. So, yep, everyone said it correctly. Pillows, stuffed animals, bumpers, blankets. And it is our job as professionals to educate families on safe sleep. So if you are in a home and see something that is unsafe, you should bring this up to the parent and document that it was discussed with them as well. Luckily, a lot of hospitals now are doing this on their tours and prior to discharge, and talking about and educating families on safe sleep practices. So the ABCs of safe sleep are alone, back, crib. So you want your child to be alone, placed on their back, and in a crib, bassinet, or play yard, which are the approved sleeping devices. So they should be placed on a firm sleep surface, so covered by a fitted sheet with no other bedding or soft objects to reduce the risk of SIDS or suffocation. An infant should never be left to sleep on sofas, armchairs, or in sitting devices. And then the AAP recommends that you room share, not bed share, close to a parent's bed, but on a separate surface for at least 6 months, but preferably up to a year. And then, like I said, the crib, portable crib, play yard, or bassinet right next to the mother or dad's side. Okay, and then a routine for the baby. So something as simple from day one, and you can even incorporate this while you're in the hospital. And if you have a family that has a baby that's in the NICU, you can also talk to the NICU staff about incorporating some of these things as well. So we can do a bath, a warm washcloth, having the feed in the light so that they know that it's still not quite bedtime yet, putting on their pajamas, swaddling if they're still being swaddled, turning off the lights to that complete darkness, and then the sound machine on and in their bassinet. So beginning a routine like this from day one will help baby tremendously in understanding when naps and bedtime are about to take place. So they will know those cues and say, okay, it's nap time, it's bedtime. And you can usually shorten the nap time routine down to, a book and a swaddle and place in the crib, and then your bedtime routine be a few, 10 to 15 minutes longer than that. Okay, so now we're going to talk about soothing baby. It can be overwhelming when you have just fed your baby, changed a diaper, put on warm clothes, and they are still inconsolable. On the next slide, we're going to talk about my favorite soothing methods for baby, especially during that witching hour. So the witching hour usually takes place in the late afternoon or early evenings after baby has had a long day and is very tired. Okay, so the 5 S's. Dr. Harvey Karp, you can see his picture in the bottom left corner, is one of America's most trusted pediatricians and child development expert. He is also the founder and CEO of The Happiest Baby, who has a bassinet and some swaddles that he has created. And he is the one that discovered the 5 S's. So the first S is the swaddle. Swaddling recreates the feeling of the womb and is the cornerstone of calming. So babies will respond faster to the other 4s from this starting point. And you can see the baby on the right-hand side is swaddled appropriately in his blanket, but is obviously not tired. And then we have suck. So suck is the babies relax when sucking. So that's why they'll relax when you give them a pacifier and will calm down, or even offering the bottle or the breast for them to calm down as well. And then we have side and stomach position. So though back is best and is safest when sleeping, calming a baby by holding them on their side or on their stomach over your shoulder will help best. If your baby has calmed down using this method, just make sure that you slowly transition them right onto their back into their place where they will be sleeping and never on their side or on their tummy. And then shush. So the shushing sounds of a white noise machine, or even making a shushing sound yourself as a parent, can help with imitating the blood flow of while in the womb. And then the last S is swing. So swinging in tiny, fast motions helps a baby calm quickly, but be sure to support their head and neck and keep the motion small, no more than an inch back and forth. Let's see here. So there is a video that was dropped in the chat by Jeannie. It is a video of Dr. Karp explaining how you can incorporate these 5 S's and how they can be different each time and with each baby. If you have a second today, I would check it out. And he also has a YouTube channel where he goes through in depth on how to introduce these 5 S's to a baby that is upset. He has wonderful videos out there of a baby mid-cry, and he's able to calm them down instantly. Okay, so we're going to do a chat question right here. What are some of the common sleep problems that the families you work with say they are experiencing with their newborn or infant? So for these younger babies from 0 to 12 months, what are some of the problems that the families you work with say they are experiencing with their newborn or infant? And Jeannie dropped that 5 S's video again. So we'll only nap in the car, wake up in the middle of the night, wakes up frequently, won't sleep in their crib, days and nights mixed up, doesn't want to be put down, sleeping too much during the day versus night, wakes as soon as they're put down after they were rocked to sleep, can't calm themselves down at all. So yeah, colic, yes. These are all similar things that I hear from some of my sleep clients as well. And I actually just finished working with a baby who was 4 months who was only able to sleep on mom and dad's chest for all the nighttime, all of naps, and was unable to sleep in his bassinet. He just got very upset, and we slowly worked our way and got him transitioned into his bassinet and in a good place. And mom and dad got a little bit of their freedom back. Okay, so let's talk sleep cycles. So stage 1 would be drowsiness, and this is an entry level to sleep. What does it look like? It's almost as if you were to doze off in a lecture, zoning out, slow movements and slow blinking, and your awareness of your surroundings begins to diminish. And then stage 2, we have light sleep. calming the body, still aware of your environment. And then what does that look like? There are droopy eyes or completely closed, seems asleep, but is still aware of sounds and movements, and you can still easily wake them up. And then we get into 3, which is deep sleep. So this is the body restorative sleep. Immune system boosts and flushes out toxins. Physical growth takes place. And this mostly takes place during the first half of the night is when you will see the deep sleep. This, you will see a limp body, no sucking reflex, low and heavy breathing, and it also happens about 20 minutes into your sleep cycle. And then stage 4 is REM sleep, so also known as rapid eye movement. Your baby's heart rate may go up, and you may see twitching, eyes fluttering, and other movements, sorting memories into short and long term. And this is a very crucial part of sleep for development. Okay, so how much total sleep needed in a 24-hour period? Remember, these are just ranges, so it's okay if your baby is sleeping more or less than average and still doing well with feeds during the day and night. So from newborn, you will see around 14 to 17 hours. Like I just said, this is how you could see anywhere from the 14, but sometimes you could see up to 20 hours for a newborn, which you're very lucky if you have that. And then 3 to 6 months, you'll see around 12 to 15 hours. And as you can see on this chart here, they slowly start to drop down, but in between 6 to 18 months is a really big range. So it could be 13 to 15 hours of sleep. So you may see more of the 15 hours towards the 6th month, and then more of the 13 hours towards the 18 months. And then once you hit 18 to 36 months, it's around 11 to 14 hours. Okay, and then you have 3 to 5-year-olds, around 10 to 13. And then as you can see, as you go up into the teenage years, around 8 to 10 hours. Adults, usually around 7 to 9 hours. I know some of us prefer 9 hours. And then the elderly, they usually only get 7 to 8 hours. And you'll typically hear them say that they go to bed at a very late hour and then like to sleep in a little bit later in the morning. Okay, age-appropriate wake windows. So this is a very important aspect of infant and toddler sleep. And this is where, as a therapist or an early intervention provider, you can make a simple suggestion, and it may help tremendously with a family who is struggling with sleep. So when you go to work with, say, a 12-month-old and they tell you he doesn't like to nap, most likely that is not true, and they are just not incorporating the correct routines and giving them an opportunity to sleep at the correct time. This is going to be a part of your handout, so you'll have this to reference when you are working with families. But what is a wake window? A wake window is from when your baby wakes up in the morning from a nap, from the morning or from a nap, and then you calculate how long that they'll be awake until they go back down for another nap or for bedtime. So 0 to 3 months, you'll see a range from anywhere from 30 to 90 minutes of awake time. So as soon as your newborn opens their eyes and they've been awake for 30 minutes, you're going to want to keep your eye on them and make sure that you're offering a nap around that time. Sometimes they won't go to sleep unless you introduce that to them. So you'll see those windows start to stretch. Some babies may be able to handle an hour at that time, but you will see the 30 minutes typically happen in those first few weeks of life. And then 4 to 6 months, it ranges from 1.5 to 2.5 hours. And you can see as they get a little bit older into the 6 months, it may push towards that 2.5 hour mark. 7 to 12 months, 2.5 to 3.5 hours. 13 to 18 months, 3 to 4 hours. 19 to 2 years old, 4 to 5. And then once they hit once they're 2 years old and older, they can definitely handle 5 to 6 hours of awake time during the day before they go down for naps. Are these developmental age for kids with delays? Yes, these are still this should still apply for children with delays as well. If you do have a child that was premature, you will still want to go off of their adjusted age. And I've worked with a couple premature babies, and you may have to play around with the times because sometimes it could be their actual age versus their adjusted age that will work for these wake windows. Okay, so now after the wake windows, we talk about how many naps and how much daytime sleep is actually needed. So 0 to 3 months, you could see anywhere from 4 to 6 naps a day. And these naps may last 15 minutes or they could last 2.5 hours. You will usually see 1 or 2 longer naps during the day, and then they may go in and out of some short naps as well. The total daytime sleep is around 4 to 6 hours a day or during the day. 4 to 6 months, that's when it's around 3 to 4 naps. And then you'll see around 3 to 4 hours of daytime sleep. For 7 to 13, number of naps is 2, total daytime sleep around 2 to 3 hours. 13 to 18 months, around 1 to 2 naps, total daytime sleep around 2 to 3. The same total daytime sleep is needed for 18 to 24 months, 2 to 3 hours, and the number of naps around 1. And then once you hit that 2-year mark, you'll see 1 nap, and it should last around 1 to 2 hours. Sometimes it can be a little bit longer, but we want to make sure that that is not impacting their nighttime sleep if they're getting too much. So toddlers, in my opinion, as a sleep consultant, should continue to be offered a nap until around the age of 3 or 4. So many parents think that their child may be ready to drop a nap around 2 years of age, but I would continue to offer this to them. A lot of times, and we'll discuss this in the regression section, you'll see a 2-year-old start to protest their nap. So there'll be a few weeks where you're like, I don't think he needs one anymore, but most likely he does. So keep on doing it. Okay, and then we have schedules versus wake windows. I know that some people and families prefer to have a schedule where they actually go off of the clock. But as a sleep consultant, I personally like to suggest following wake windows until around 6 to 8 months, because this is when a baby typically drops to 2 naps a day. And then it's possible to get them on a set schedule for naps and bedtimes. And this can take a few days for things to fall into place. But once they've definitely dropped that 3rd nap, you can say that they are waking up at 6 a.m. consistently, going down for a nap at 9:30 and 1:30 every day. This just gives parents a lot of, they understand what's coming next. And then the baby also starts to fall into that and can understand when exactly they're going down for their nap. It's a little bit harder when you are still on 3 and have that last little cat nap of the day to do that. Okay, so we're going to do a poll question. When would you typically see a child drop from 2 naps to 1? So Jeannie's going to throw up the poll here, and we have 4 different answers: 6 to 9, 10 to 13, 14 to 18, and 19 to 24. So when would you typically see a child drop from 2 naps to 1? People are still getting some in. Okay. So the answer is actually C, 14 to 18 months. Now, remember, every child is different, but this is when you usually see that 2nd nap go out the window, and it's just down to 1 nap in the middle of the day. Our son, he, right at 14 months, started showing signs and not wanting to take his 2nd nap. So we transitioned him to the 1 nap right at 14 months. But then there are some babies that will go up to 19 or 20 months. It's rare that I hear of that, but if it's working for you and you're still on 2 naps a day and it's not affecting the nighttime, then keep on doing it. Okay, so now we're going to talk about regressions. We have several regressions that you will experience as a parent, and then also that you may hear as a provider when you go into the home and say, oh man, it was a rough night last night. So we have 4 months, 6 months, 8 to 10 months is usually the range for this one, 12 months, 18, and 24. So we're going to start with the 4-month regression that I know that I mentioned this at the beginning. So let's go ahead and dive into this one. So this is the first in the series, and this is when your sleep cycle begins to change. This is when I hear most parents say, everything was going really well until he or she turned 4 months. So you will do anything to get your baby back to sleep in the middle of the night. So what can you expect for this regression? You will see and hear your baby waking more frequently through the night outside of their night feeds, of course. Unfortunately, you can also expect this to happen during naps as well. So why is it happening? Your baby is now entering a new sleep cycle that is different from newborn sleep. So outlined in the previous slide, your baby's sleep cycle is maturing. So each time your baby goes through a cycle, they can completely wake up and not know how to put themselves back to sleep. So this is when you will hear the whining and crying as they emerge from their cycle and are completely awake. Some babies won't experience this at all, and you won't hear them. And they may be able to transition from each cycle on their own without needing it. And some may experience it to the umpteenth degree and may have some very rough nights while their sleep cycles are maturing. Okay, so now we're going to touch on 6 months, 8 to 10 months, and 12 months. So the 6 months, when I say what to expect, you'll likely hear this for every single regression, is that you can see early morning wakings, short naps, and multiple night wakings. So why is it happening at the 6-month mark? A lot of this regression can stem from new developmental skills such as rolling, eating solids, and this is when you typically start to see your baby's first tooth poking through as well. Some babies handle teething really well, and others struggle with the pain and discomfort that comes along with their new teeth. Usually it's the first 3 days of the tooth actually erupting that can be the most painful for the baby. So you'll want to discuss with your pediatrician if there's any pain relievers that you can give them and get their permission to give them those. So then we have 8 to 10 months. I know that one can look really scary because you're like, wow, that's a really long time, but it usually happens within this range. It's a wide range for a reason, and many babies experience that during these months or not at all, just like all the other regressions. So why is it happening? The same reasons apply here as the 6-month regression. Lots of developmental changes for your baby that could include sitting, crawling, and really just becoming more interested in their world and also aware of their world. So then we have the 12 months. So why is this one happening? Well, you are welcoming your baby into toddlerhood, and your child may be experiencing their second round of separation anxiety and may cling to you more often than usual. So they will want to be able to keep you in sight at all times, hence why naps and bedtimes may be challenging because they want you to be present during those times. They are also starting to understand what you are asking of them, such as giving a toy when you request it or pointing to familiar objects when you name them. Okay, and then we have 18 and 24 months. So 18 months, your toddler is becoming very opinionated and it lets you know when he or she doesn't prefer something. They are also most likely on the go and trying to climb onto anything that they can. They're becoming very independent and will prefer to try and do things on their own before asking for help. Since they are so opinionated now, they will let you know when they do not want to take a nap or go to bed, hence this regression. Another change that could possibly be happening around this age too is some molars could be coming in, which can be irritating to your child. And then the last one, you'll still have bumps in the road after 2 years old, but the 24-month, aka 2-year regression. So they are absolutely developing a strong sense of self in addition to this, their language is exploding. So they enjoy being around other children their age and are interested in what they are doing. They also may be going through another round of separation anxiety. So this can be challenging once again at naps and bedtimes. So what is the number one thing to remember during any regression is to stay consistent. So if you are thinking about introducing something to comfort them in the middle of the night, just know that they may expect that for the following night and the following night after that. So staying consistent, talking with your partner, making a plan on how you are going to tackle these regressions and comfort your child at the same time while still keeping your sanity. Okay, toddler sleep. This one's a little bit different than infant sleep. And I know that we have all worked with toddlers or we have our own. So this means we all understand they can be quite unpredictable at times, but it doesn't have to be that way with sleep. We have a question here. At what age is it safe for a child to take a toy to bed or have a pillow and blanket? So the AAP says a small little lovey around 1 year. Pillow should be around, introduced around 2 years of age. And then a blanket, it should be a breathable, like muslin blanket around 12 to 18 months. So with toddler sleep, studies have shown that kids who regularly get an adequate amount of sleep have improved attention, behavior, learning, memory, and really overall mental and physical health. So not getting enough sleep can lead to high blood pressure, obesity, and even depression. I'm sure many of you have had sessions where the parents have said, oh, he didn't nap today, or he didn't sleep much last night. And it was very obvious with the child's lack of attention and behavior. And that's when you probably had to end the session early because the child did not have a good night of sleep. And there are 4 key elements of toddler sleep. We have communication, nutrition, emotional well-being, and consistency. So communication is really talking openly with your child on expectations surrounding bedtime. So not talking negatively about sleep and setting clear boundaries with them and holding those boundaries as well. The second is nutrition. So nutrient-dense meals, avoiding high sugar foods, especially before bed and nap times. Emotional well-being. Intentional play with your little ones, so no television during this intentional play, and making sure that you're having that one-on-one play with them or their sibling as well. And then we don't want any TV or any kind of blue light of any sort at least an hour prior to bed. I like to say an hour and a half to 2 hours to limit that stimulation. And then consistency. So this is the biggest one, and you can all relate when it comes to providing therapy services to children. If there is no consistency, you will not see the progress that you want. So your actions need to follow your words with toddlers and sleep. So if you're working with a family and they say, well, we tried this once, encourage them to be consistent and stick with something for a few weeks before writing it off. Okay, we're going to do a chat question here because obviously toddlers are different, like I said, than the infants. So what's the biggest challenge you see with toddlers and sleep from your clients that they say? So drop your answer in the chat. What is the biggest challenge you see with toddlers and sleep? Waking up and crying until they get a bottle, sleeping with parents, going into their bed in the middle of the night, second nap too long, yes. Transitioning to their own beds. Yes, transitioning to their own beds is a whole different ballgame. Getting out of bed at night and going into parents is one of the most common ones that I see. Sleeping anywhere they land, yes. I've seen that they'll sleep on the couch or on the floor, anywhere but their own bed or crib at night. TV on and in on parents' bed. Yep. And then toddlers too, the breastfeeding for comfort versus for hunger. Usually all night long on demand when they want to. Doesn't need sleep. Parents must fall asleep in the bed with them at the same time. and then they can't break this cycle. Inconsistent sleep schedule. Yes, that is a number one thing I see too as well. These are all things that I hear too from my clients with sleep. Thank you for sharing. Nighttime terrors, yep. Okay, so I'm going to talk about my two favorite toddler sleep strategies that can help with incorporating a routine or really kind of diminishing some of those nighttime frustrations that you may have. So the first one is the bedtime pass. So the idea behind the bedtime pass or ticket is that the child is allowed to call you back one time during the night for an extra hug, kiss, water, etc. So if he or she uses the pass in the middle of the night, you take it so it cannot be used again. You will give this pass back to her and him in the morning and praise her for using it appropriately. So this works so well for the kids that like to pull out all the stops at bedtime. That say, well, just one more of this, just one more of this. Before you start this, you need to set clear boundaries and expectations on what this is going to look like. So if you're going to have 2 books at bedtime, they can use the pass for the 3rd book and then it's gone for the night. So I like to encourage my families to have their toddlers be a part of this as well. So talk to them days prior to how this is going to work. Let them make their own little pass with stickers and colors and anything that they like so that they know that they're a part of it and that it's special to them. Okay, and then my second is the bed or nap time visual chart. So I know a lot of you have used visuals for your clients, and this is the same concept. So having visual cues not only in their bedroom, but around the house is a great idea as well. And you can use, I use the app Canva to create these typically, but I know that as therapists and as early intervention providers, you may have access to some other programs and you can customize it for each family that you're working with. So if they have a specific bedtime routine that they are following, like they have a little dance party with families, you can put pictures in there for them as well, and then get it set up in their bedroom so they can see it, on the refrigerator, on any kind of door, so that they're reminded on what the routine actually looks like. Okay, so last we're going to touch on autism and sleep. So 50 to 80% of children with autism have one or more chronic sleep problems, and they usually take 50% longer to fall asleep than typically developing children. The name of the app is called Canva. I'll type it in here. They have a free version, and that can, it works wonders with, you can just make your own little chart there. So back to autism and sleep, some of the causes that you may see with children are sensory challenges, melatonin, sleep apnea, and then also restless leg syndrome. So the first is the sensory challenges. So many children with autism are hyper responsive to auditory, visual, and physical input. They will continue, most children will continue to sleep peacefully if their parent opens the door, but a child with autism may wake up abruptly and hear any kind of noise that is happening. So the sound of coffee makers, ticking clocks, or any outside noise can actually keep them awake. So this is why I highly suggest a sound machine for their bedroom. This can definitely keep out a lot of the outside noise that is happening so that dad and mom or siblings can continue to go about their day during nap time, or do things at nighttime as well without disrupting their child. So problems with melatonin. So melatonin has been found to be either higher or lower in children with autism. So typically melatonin levels rise in response to when it gets dark outside and dip during the daylight hours. So studies have shown that some children with autism don't release melatonin at the correct time of day. So this could be a huge difference in when your child is actually going down for a nap. I know a lot of families struggle with, well, he won't go to bed until 1 a.m., wakes up at 12 p.m. the next day, won't take a nap. So this is something to discuss with your pediatrician as well if you see that their clocks are off. So sleep apnea. This is a huge cause of sleep disorders in the autism population. So over 40% of children with autism have been shown to have sleep apnea. And this is probably the most important thing that you can ask a family whose child is struggling with sleep, is to see if they've spoken with their pediatrician about a sleep study and possible sleep apnea. So this can not only cause night wakings and exhaustion, but can also cause hyperactivity during the day. Then the last one, which this is very interesting, and a study that has come out that will be linked, I think, either in chat or in the handout. So restless leg syndrome, a new study that was released last month revealed a significant connection between restless leg syndrome and sleep troubles with children who have autism. So per the research done by Emory University, it was found that restless legs can be the underlying cause behind bedtime resistance and motor restlessness in children with autism. So they also indicated that since the diagnosis of restless leg relies on the patient explaining the symptoms that they are experiencing in their own words, many patients with autism may not receive a diagnosis because they have language and cognitive delays. So they will be, they're unable to communicate with their parents and with doctors on how they're actually feeling. So this is something that's new that is worth mentioning to your families to see if their pediatrician would be willing to dig a little bit deeper to see if this is something that they are struggling with. Okay, so suggestions. Lisa asked, have you had any experience with a child that has low iron and sleep issues? Not yet. I've read a couple things on it, but I have not had any personal experience working with a child with low iron. Suggestions for healthy sleep habits for children with autism. So limiting screen time, routine, plenty of preparation, and timers. So I know I mentioned no screen time with toddler sleep, but limiting the screen time for 1 to 2 hours prior to bedtime can really help with them calming down at night. So these are extremely stimulating and can really disrupt the onset of sleep for them. So routine. So using a flow chart, as mentioned in the previous slides, and having them placed all over the house as visual cues on what to expect for naps and bedtime can be huge. And then plenty of preparation. So they usually thrive off of routine and what's coming next. So making sure that you are giving warnings on what is currently happening and what you should expect to see next. And then also using timers during bedtime routines. So having timers, you can use the little sand ones and let them be a part of it and flip it over. And you can use this while they're brushing their teeth and make sure that they're doing that. You can have one when you're reading books or whatever your routine is, having some kind of timer and then letting them be a part of it, like press the button or flip it over, can be really empowering to them. So the last thing is also considering adding a weighted blanket with your occupational therapist or pediatrician's approval if they have anxiety at nighttime. Joint compressions can be very helpful at bedtime as well, but this also needs to be taught by a professional and discussed with your therapist or your pediatrician as well. Okay, so that concludes my presentation, but I would love to hop on and answer some of the questions that I missed. I know that Corey has taken some notes on some of the ones that I wasn't able to get to, so I would love to go ahead and answer those or any additional questions that anybody may have.
Thanks, Stephanie. Yes, just to be sure, Tiara, I did note she says that there needs to be a class all on its own about autism and sleep. So thanks for that information. Christine is asking, she has 2 children with Williams syndrome who it sounds like have very specific sleep, like sleep in, one sleeps in his swing and the other only sleeps in his car seat. Do you have any suggestions?
It would depend on how old the babies are at the time, or how old they are right now. So could you answer that for me so I could get a better picture?
Let's see.
One is a few months.
One
and
is
the
a few
other
months and the other over 2.
Okay, so I'm assuming the one that's a few months old can only sleep in the swing. And then the one over 2 is in the car seat, I'm assuming, is where most naps take place. For the transition from the swing to any non-moving, bassinet crib or anything, the first thing I would suggest is trying with 1 nap a day. So don't overwhelm yourself and say, we're going to just go at this cold turkey and do it. Starting with that, and then also setting limits to know, like, okay, this is too much for me, this is too much for the baby. So if you start with 5 minutes a day of trying to calm the baby while putting them in the bassinet, and then increase it to 10 minutes the next day. So starting with 1 a day and just slowly working your way into getting your child into comfortable on a flat surface that's not moving is my suggestion for that. The same goes for the 2-year-old. If they're not sleeping in their crib or bed for nap times, I would suggest slowly moving into that as well. Most likely they're on 1 nap a day. So getting him or her comfortable in his room and exposing him to his room. So making sure that he knows that that is a happy and fun place and a time to rest. So getting him in there, starting to talk to him too about sleeping in there for naps.
And Stephanie, I'm not sure if there have been a couple questions and comments about iron. Some SD wrote, I checked a ferritin, I don't know if I'm saying that right, an iron panel. And then the question, have you had experience with a child that has low iron and sleep issues? And I'm sorry, I'm not sure if you hit that one.
I hit the one on iron. I've read a couple things on low iron with children in sleep and like grinding their teeth and whatnot. I have not personally worked with anybody, so I can't, base that off of personal experience. But I do see is restless leg related to magnesium potassium deficiency. Could possibly be. I guess it depends on the severity of it, but that's definitely a question and a panel that needs to be discussed on running with your pediatrician for this specific child.
And it looks like there's another link related to that one, managing, any suggestions about managing improper time of melatonin release?
So I am in the camp of going at things a little bit slower. So if you can slowly shift a child's schedule and also really incorporate some of those things that I discussed, like the sound machine and the blackout curtains, and getting your child to know, like, it's 8 p.m., it's dark outside, it's time for sleep. So say if your child is not going to bed until 11 p.m. and you want to shift that back to 9 p.m., slowly doing that each night and moving bedtime back by 15 minutes. And then you may see a difference with when they wake up and then getting them back onto a normal cycle or clock for them to have naps and bedtimes.
Let's see. Kim Sprangle asks, when should swaddling be ended? And she's looking for sleep assistance for blind children.
So swaddling, there's one doctor on the AAP panel that says it should be stopped at 8 weeks, but the official recommendation is any sign of rolling. So as soon as you see any signs of rolling in any direction, you want to discontinue swaddling. And then what was the second half of that
suggestions for blind children. Sleep issues with blind children, I think is.
So I know that we talked about like visual cues, and obviously that's a little bit different with a child who is blind, but we want to incorporate the same things in talking with your child about what's coming next. Also too, spending time in their room. If they're not spending a lot of time in the room during awake hours, making sure that that is happening and that they're playing with things that they really enjoy and things that they really like to do in there. But I would try to follow as much verbal cues as you can. So always talking about what's coming next with a child who is unable to see and what they should expect to happen for the next stage of when they go into the room, down for nap, down for nighttime.
See, Kathy asks, parents ask what age to roll baby to their back when they roll to tummy when sleeping.
I'm sorry, I was simultaneously reading another question. Can you say that one more time?
Oh, sorry. Would that be easier, Stephanie, or do you want me to keep trying?
You keep doing it because I'm lost in there. So go ahead.
Okay. Kathy asks, parents ask what age to roll baby to their back when they roll to their tummy when they're sleeping.
So the AAP says that if your baby is able to roll to their tummy, they should have the strength to push up during the middle of the night. And that's something too that I've had parents just ask their pediatrician, like, is it okay if he flips over onto his tummy if I let him stay there? And then just, most likely they're going to say yes, but that's definitely something that you'll want to ask them. But the AAP says that if your baby is rolling, they should be okay to sleep in that position. If you are uncomfortable at all, have that chat with your doctor. And I know that a lot of parents want to flip them back over and it becomes a thing in the middle of the night.
See, Stephanie E. Ring says, what about kids that sleep too much? I have a couple kids with infantile spasms that can't get on a routine for sleep or eating at nearly 2 years old.
Okay, so they're sleeping, from what I understand that question, they're sleeping a lot and there's no routines. I would suggest starting with day one, if you want to incorporate a routine. Say they sleep until 9 a.m. every day, but you want them to wake up at 8 p.m. Slowly wake them up at 8:45, one day 8:30, the next day 8:15, and see if you can't get them onto a schedule of that. If they're doing well during the day with the sleep that they have too, talking to the parent about what they're comfortable with and if they even want to get them onto more of a schedule with their child. Some parents are okay with the, just going with the flow of things. So it's the same thing with providing therapy services. We have to know what's most important to the family.
Okay, let's see. Stephanie, this one, Rosario says, any suggestions for thumb sucking when sleeping?
Ooh, that's a hard one coming from somebody who sucked their thumb per my mom for many years. There really isn't. It's something that kind of just falls off on its own. But if you're starting to see like sores or anything on the child's thumb, that's when you want to talk to the pediatrician about, like, is this, open cut going to become infected if they continue to suck on it? But if that's their means of calming down and if that's how they go to sleep at night, then that's a great tool for them to put themselves to sleep, especially in the infant world.
Okay. There's a question about what observations would you see in a 2.5-year-old or 3-year-old that might have restless leg syndrome?
And can you repeat that question one more time? I'm sorry.
What I think the person is asking, what would you see if there was restless leg syndrome in a 2.5 or a 3-year-old when they can't tell you what's going on? What observations might you see?
So from what I'm not a physician, but from what I understand from what I've read is that you will, if you have like a monitor and you're able to watch your child, it's just constantly moving around at night. Like it is a constant thing. And then you will see them be cranky and upset the next day because they technically did not get that good, deep and REM sleep because they were unable to because the restless leg syndrome. This is a new study, and I can't remember, where did we say that did we put that in the actual chat?
I'm sorry, say that part again, Stephanie.
Did we put that in the actual chat, the link to the RLS, the restless leg syndrome article?
Jeannie, can you help with that? I think it was sent, but we can definitely get that link.
Okay.
We'll work on that, Stephanie.
Okay.
So the restless leg syndrome is what was an additional resource, so we can.
Yeah. And that is something that is new to me. This just came out it was discussed in the Association of Professional Sleep Consultants, and it was super cool to read about that this could possibly be it. So I think it's something that should definitely be mentioned to your families, so that they can mention it to their pediatrician or providers, or if they have a sleep doctor that they regularly go see as well.
Stephanie, it looks like there are a little cluster of questions about night terrors. Is there a good resource to help parents understand what those might look like? Should you wake the child? Or is there a resource that we could share with them after today?
Yeah, there is a couple links to some studies too that I can send about night terrors, which night terrors usually happen at the first half of the night. And this can happen due to too much screen time, maybe a little bit too much sugar, overtiredness, that can happen. So you'll want to, from what I have learned, I have not worked with any child specifically with night terrors, is you'll want to make sure that they don't become combative, but make sure that when they do finish the night terror that they're having, that they are woken back up so that they're not getting back into that terror. Nightmares usually happen on the second end, where that's something that you dream about. But I do have some links to some research articles that have to do with night terrors, and we can send those out.
So what will happen, you guys, for some of these resources, the excuse me, the update that comes from the professional development team will be based on some of this information from Talks on Tuesday. So you will be seeing some of these resources if we didn't send ahead of time. As Stephanie's gathering what people are asking for, I will add those to the update, and that usually comes out in the middle of the month. We will also, if you go to the archive Talks on Tuesday for today's session, you'll be able to listen if you want to listen to the webinar again, and the resources will be connected. Stephanie, I'm looking at our time, and we try to honor everybody's 1 o'clock. So the last question I can grab quickly is, when you discuss using visuals, did I understand correctly that you suggest creating visuals that support sleep and leaving those around the house for the child to see even at non-sleep times?
Yes, I think that can help a lot. If you're not having too many issues and you just want to incorporate some new nighttime and nap time routines, then you can just put it in the bedroom or in the bathroom, like while they brush their teeth. But if you have a child that's really struggling with these routines, then you can place them several places around the house so that they are reminded of what their bedtime routine looks like. So really, once again, child and family dependent, and you kind of have to base that off of what they want or what they need for that.
So I think that's probably, I hope I caught everybody's questions, but if I missed any, you can see on the screen that Stephanie has a website. She also has Instagram. I have asked, or Stephanie, if you can, I couldn't grab your email quickly enough. If somebody could type that in chat, you are welcome to email Stephanie. And again, stay tuned for all of these resources being shared on the archive. Stephanie just dropped her email. So we want to thank everybody for joining us. We also encourage you to plan to join us for the May and June session, where we will be talking about what we've learned from tele-intervention and some research that's going on and some practical experiences from people who have now been doing to to see what's going to happen in the future with tele-intervention. I should have had this date. Stephanie, do we have one more slide? Is it May 6th? I don't have the date right in my head. May 4th. So I will remind you that the next Talks on Tuesday is May 4th. Stephanie, if you go back one more, please. Just a reminder that after today's session, you will get a link. When you complete the survey, you will get your certificate of completion or attendance today. So thank you all for joining us, and I hope everybody has a good afternoon, and we'll look forward to having you join us in May. Thanks, everybody. Stephanie, thank you so much.
Thank you. Thank you guys for coming.